Nice to be with you today. And I mean, I'll begin by saying that I'm looking at things perhaps a little bit like Jose Manuel, my good friend, from the perspective of, what would I do as a prime minister or leader of the country at the moment, and what would be the indicators that I'd be sussing out. And when I was listening to both, Stephen Morrison and then to Professor Chan, it's funny to see that we're all getting propaganda from different types of sources here. So I'll give the European propaganda. Now, I think basically that if all prime ministers and leaders at this particular moment are looking at three things. Number one, how many people have died on my watch? So the death toll. Number two, how has my vaccine rollout succeeded? In other words, was I able to procure, was I able to roll out, and have I been able to vaccinate my population? And then number three, how do I get the economy going again? In other words, by way of comparison, how did my economy do to comparing to another one? Now, in all of this, there will be a game of statistics and numbers and place, but of course, there's a lot of raw data and in many ways, comparison that you can't escape, but there'll be a lot of spinning about this as well. I mean, just to come back, for instance, to the notion of vaccine exports. I mean, it's undeniable that the European Union is basically the pharmacy of the world at the moment. It has exported already over 1 billion doses to 150 countries, when other countries are basically committing to do that. That's great, that's nice, but basically it's all about raw data. The way in which I look at the pandemic is if you want to see it as a Netflix series, I think we've gone through season 1, which was sort of the chaos. Then we went through season 2, where we start feeling that, well, we can probably contain this and control it or live with it. But now we're moving to season 3, and there might be a few surprises, as the previous speakers have said. Now, from the European side, it's very difficult to give you an overarching perspective, especially of the healthcare systems, because they are quite different, as you'll know, in all the 27 member states. I mean, some of them are very heavily reliant on public health. Others have an aspect of private health in them. Some are a combination. Then it also depends on how you dealt with the pandemic in the beginning. And Patricia will know that Finland took a very different line from Sweden. Italy was very heavily hit, but then the decisions, what Italy have done, for instance, at the moment have gone way beyond what has been required in, say, Sweden or Finland. So, for instance, Mario Draghi said already May this year that he's going to do a calculated risk, opening up society. I say this because I live in Italy. And what he did last week or 2 weeks ago was to say that, listen, if you're not vaccinated, you cannot go to work. and Morrison talked about court cases. There might be some. But what I'm trying to say that it's very difficult to package things into one. Now, having said this, the way in which we look at things on the European side is, of course, navel gazing. I admit that. But if you look at the three main crises that we've had in the past 10 years, so the financial crisis, which turned into a euro crisis, then the asylum crisis, which turned into an immigration crisis, and now COVID. I would argue that COVID was the one where the European Union had done its best crisis management ever. And I'll give you the crisis management on two fronts. Number one, the economy. Number two, health. So on the economic side, very quickly, the EU member states, and especially the Commission and the European Central Bank, realized that we are in this boat together and we cannot be pointing the finger at anyone. So let's do something about it together. First, there was the PEP program coming from the ECB. Secondly, there was the European Investment Bank, which pumped in additional 25 billion, which might sound small, but calmed down the markets at the time of investment into small and medium-sized companies. Thirdly, the European Stability Mechanism which is basically a financial bazooka of 80 billion euros, was turned into a health instrument. Fourth, the Commission came out with its SURE program on unemployment. And fifth and finally, the Commission was able to negotiate with the member states a very impressive Next Generation Europe financial package. And they did that in 4 months. Now, compare to the chaos that we had in the asylum crisis and compare to the chaos in the Euro crisis, where the ESM took 4 years, you could argue that economically, Europe did the right thing. Of course, very Keynesian, but it did it. Secondly, on the health side, I think the European Commission took a calculated risk by procuring the vaccines for the member states. I come from a small state, and I can guarantee you that if the Commission had not done this, we would have been last in line to get the vaccines. But they actually got a lot of slack and criticism for timing and the rest of it, but did a really good job. And at the end of the day, gave a promise that by the end of this summer, we would have 70% of the European population with a double vaccination. And sure enough, they were able to keep to that promise. So I think, thumbs up to the Commission, their vaccine procurement, and then the rollout. Now, are we in a situation where the member states will applaud the European Commission and say, thank you, you were absolutely fantastic. Without you, we wouldn't have managed? No, because everything that's bad comes from Brussels and everything that's good comes from you in the capital. So they're not going to get any credit from that. Now, as a politician, I'll finish off with this. Life was much more complicated because every decision, every answer that you gave had to be black and white, yes or no. Jose Manuel will know this. Because if you didn't say yes or no, you were just a fluffy politician who didn't have an opinion and you were circling around the subject. Well, the truth of the matter is that in this sort of season 3, we are not in a black and white situation where we know exactly what the policies that worked were. We don't know exactly what's going to happen. So the answer that we can give you is at best, quite academic. So it'll depend. So for instance, in Europe right now, things are not looking very good in the Baltic states, in the Balkans, and some of the Eastern European countries. Why? Because there we have faced exactly the same type of disinformation and bipolar issues that you have in the United States about whether to take the vaccine or not. So I don't think that we're out of the woods yet as season 3 begins, but I think we're a hell of a lot better prepared than we ever have been in these types of issues. And as a final outcome, I do think that we are going to start moving towards some kind of a health union and better coordination of our public health systems in the member states. Over and out from Florence.